So the procedure for a baby is quite easy. The younger they are, the better. So they can come in, we do a full assessment, we take photos, and there's different classes of tongue ties and lip ties. Generally, if there is a lip tie, the tongue and lip sort of goes hand in hand, not all the time, but most of the time, if there is a tongue tie, there will be a lip tie. We come in, we do the photos, and we can either do the consult the day before and do the procedure the next day, or we can do the consult and the procedure in the same day. So what happens is, mum comes in, we do the consult, we let them know exactly what we do here at Kids and the laser and how it works, and basically the expectations, and we go through all the health and safety side of things with the procedure. Then we bring mum back into the nurture room. We play a video for her showing her the stretches that they need to do after the procedure while we do the procedure on bub. So the procedure itself is about 5 minutes, so maximum, so it's about 30 seconds per site. It's mainly just making sure that the release is done properly, checking that everything's good to go, and then we bring bub back in. So I always say to parents, babies are going to be away from you 10 to 15 minutes maximum. And because we use the laser at Kids, there's that minimal chance of reattachment to occur. So we use the water as well, which is like it has an analgesic effect on the babies as well. So we don't actually use any anaesthetic because it's such a quick procedure, and it's probably more risky to numb up a baby than it is to just do it with the laser itself, and it's so quick. And we've actually done a procedure on a 33-year-old who we did with no anaesthetic, and they said that the pain went to about between a 3 and a 4. So it's more uncomfortable rather than painful, if that makes sense. So we do the procedure, we bring bub back in. We get bub straight onto the breast to get them feeding. We let mum know that we want to see a good seal. So with breastfeeding, it's very hard for a tongue-tied baby to breastfeed because their tongue isn't functioning the right way. So to explain it best is that when you're breastfeeding, the only way that a baby can breastfeed is if they're swallowing the correct way. So if they're not swallowing the correct way, then generally you can sort of tell that there's something going on. So there's probably some sort of restriction happening in that baby's mouth. So you want bub to be on the breast, you want their lips to be sealed all the way around the breast. So like fish lips, I say to the parents, you don't want to hear any clicking noises. You want to make sure that their tongue is up the top of their mouth to swallow the right way. So we sort of give mum tips after the procedure as well on what to look for. So it's not just one of those instant procedures where it's done and then everything is magically fixed. There's a little bit of work involved after the procedure, and there's also a team of people there to help. So we always suggest seeing a chiropractor, because if they're restricted, they're quite tight and they'll be pulling to one side. So a body worker can help sort of relax bub and get the muscles to sort of be functioning the right way. And then we always give them a call after the procedure just to see how they're doing. They also come back then in 6 weeks' time to make sure that the release has worked well and that the function of the tongue is working. They've got exercises that they need to be doing for those 6 weeks just to make sure that they're strengthening the tongue up and getting it where it needs to be. But yeah, so it's not one of those things where we just do the procedure and then they go on their way. Here at Kids, it's all about quality care. So we have reviews with these babies for 3 years. So if there is any reattachment for any reason at all, we actually will re-release that site with no out-of-pocket expense, because we're here to make sure that they are getting the care that they need and that they're functioning the right way, and we want to see them grow to their growth potential and be the best that they can be, basically.